Good morning. Thanks for joining us today. I'm Cheryl Garrison, Director of Talent and Workforce Solutions at the Untitled Chamber. We host these Community Matters discussions every week to connect you with local, state, and national leaders. You can find past recordings as well as the upcoming Community Matters schedule at www.greenvillechamber.org. Just a couple of housekeeping matters. All attendees should be on mute, and please submit all questions through the chat feature. Before we get started this morning, I would like to take a moment to thank Spectrum Reach for their generous sponsorship of this program. Spectrum Reach provides scalable TV and digital advertising and marketing solutions that can help to grow a business by reaching the right customers through data, innovation, and creativity, all of which are driven by insightful research to understand consumer behavior. You may know that Spectrum Reach was just voted America's most trusted media partner by the Myers Report 2020. And as such, Spectrum Reach is committed to deliver on promises to provide insights, resources, and custom solutions. As our communities begin to reopen, Spectrum Reach is fully invested with helping businesses rebuild. We'll place a link where you can learn more in the chat feature. I'm thrilled to be joined today by three talented leaders in the childcare space. Derek Lewis, Executive Director at Greenville First Steps and Greenville County School Board Trustee. Stephanie Noble, Executive Director for the YMCA Judson Community Center. And Julie Hollister, Association Director of Youth and Family Services for the YMCA. Derek, we'll get started with you. I've heard that more than half of childcare providers in our region have closed or won't make it through the summer. Yesterday, the Post and Courier did an article that stated that 67% of South Carolina is now a childcare desert as a result of closures due to COVID-19. I think it's also important to note that access to childcare and affordable childcare was already a significant workforce barrier in our region before coronavirus. Can you weigh in?
Sure. Thanks, Cheryl, for having me on the call today. And I just really appreciate, first of all the work the Chamber is doing around early childhood. To list the lack of childcare and the need for more childcare as a priority is something the Chamber's had as a priority for more than a year now. And it definitely has become more clear during the COVID-19 crisis that there is a considerable link between access to childcare and families returning to work. And what we're finding now is that you're correct, that more than half of our childcare providers in Greenville County are currently either closed or don't believe they have the funds to make it through August to remain open. And that puts a huge burden on our families to return to work and also have adequate care for their children while they return to work. There are about 20,000 children in Greenville County in childcare. So if half of them closed, we're talking about 10 to 12,000 kids who would not have access to care.
Thank you, that's substantial. Julie and Stephanie, let's talk at a high level. What's going on at the Y and what are you seeing so far this summer?
So at the Judson Community Center, we typically at this time would have about 100 kids in our facility. And right now we have about 35. And that really is due to keeping staff and participants safe. And so it's disappointing, but safety and the health of our participants are really key.
What we're seeing from a global perspective from YMCA of Greenville, we have 5 centers or YMCA branches that offer childcare. And a typical week for summer camp, we provide services for 12,000 children. And our capacity in which we're serving for this summer is 400 children per week. The reasoning being exactly what Stephanie said, and making sure that we're providing a safe environment for our staff and for our children. What we are seeing as well is the parents who are in our programs, the families that are being served are very grateful that these services are open and that we're able to provide, because the panic and fear of childcare within our community is real, and these parents have they need to work, and they're scared for their employment, and so we're able to provide a service not to the max capacity that we're able to, but for the ones that we're able to serve, we're really seeing a positive impact within those families so they continue with their new normalcy within COVID.
Just a couple of follow-ups. So what types of safety precautions are you taking?
I'll be happy to answer that. So each of our centers, we have health screenings for all of our children. So they will get temperature checks, and there's 5 pre-screening questions that they have to answer. We log those daily. If they have a temperature of 104 or higher, or if they answer yes to any of the pre-screening questions, they are not able to attend our programming for that day or before they're symptom-free for up to 72 hours without fever-reducing medication. We also have new roles within our YMCA. We have a support staff that is for all operations of summer camp, which basically cleans and sanitizes all of our areas after groups transition. Our group sizes are smaller. We don't intermix with any other groups or huddle groups for the fear of, just trying to detain all the germs and all of the things that can happen when you mix groups. And that's through recommendations from the CDC and our state and local governments. And we've also done as little as all of our supplies. And so we have taken on kind of the mantra of what the school district does. And when they ask if you're going to kindergarten or first grade, here's your list of supplies that you need for the school. We've done the same thing for summer camp, which is new to us. And so that way we're not having shared scissors and crayons and all of those things to be able to eliminate some of those germs and passing of germs to help. And we're very thankful for our partnership with First Steps, who is able to help us supply supplies for us to be able to do that.
So I heard a story about pool noodles. Can you tell me a little bit about that?
So our youth and government branch director hosted a Horizons Values Conference, and one of the ways she was able to keep the kids from being too close to each other was really literally putting pool noodles between each of them. And we have lots of pool noodles. We have adopted that at Judson, and we have lots of pool noodles, and we've even staff have designed games like tag, but using pool noodles instead of actually physically being on each other. So pool noodles have become our new friend, and it's taken on a totally different use, which is nice.
That's nice. So speaking of staff, how has your staff felt, about either being at work, returning to work? What has that been like?
I think most of our staff have just been excited to get back to the place that they like to be every day. And the other thing that we're doing in regards to staff is they have to take their temperature and answer those questions and follow all of those protocols and wear a mask when social distancing is not possible. But I think overall here especially is the excitement of just kind of getting back to a better routine.
So for anyone that may know the answer, do we know about how many families are seeking childcare and can't access it in our area?
Well, you know from the YMCA's numbers that a substantial number of families who would have received care at the Y aren't receiving it because of the new social distancing practices. We know that in the county there are 21,000 slots in licensed childcare providers. Those are pre-COVID numbers, and so if you're seeing numbers being reduced by 50% because they're closed, and then an additional 25% because of new social distancing guidelines, you're looking at 10 to 15,000 families who are not able to have childcare that had it 12 months ago.
Derek, can you debrief us on what happened with the county council funding on Friday for childcare in Greenville County?
Sure. So County Council had $91 million of COVID relief funds that were allocated directly to the council based on the population of Greenville County. We qualified as a county as opposed to, say, other counties in South Carolina that qualified as a state. And so the council approved that $91 million, and the majority of it went to small businesses. But through some advocacy work, particularly by people on this call, we were able to get council to allocate $1.7 million to childcare providers in Greenville County. Now, that's a substantial amount of money, and presumably it would go to help every licensed childcare provider in Greenville County and some registered childcare providers in Greenville County, with either covering some of the cost related to COVID expenses like cleaning supplies, personal protective equipment, and training. There's a lot of details about what it can and can't be used for that haven't yet been ironed out, but that $1.7 million will be the largest single investment County Council has ever made towards childcare in the 20 years I've been here. So I'm really appreciative that Council was able to pivot and include those allocations in this funding.
That is excellent news. Stephanie and Julie, the Y has been working closely with Greenville County Schools this summer. Can you tell us about that?
Yes, we've been working with Greenville County Schools in a couple different arenas. The first one really being when some community providers came together, United Way, Greenville County Schools, First Steps, and the Y, New Spring Church, around how do we wrap our arms around emergency childcare. So that happened really before summer camp programming took place. So they really helped us navigate what the needs are when it came to Wi-Fi and food, and currently we're partnering them on two different assets. The first one being breakfast and lunch that's being provided at all of our centers, which is a great asset for us, and also weekend meals as well. So that is a huge blessing for all of the families that we're serving, that food scarcity is not, that barrier is removed. And then also within summer camp programming, we're really working on trying to reduce the summer slide. As we know that going into the fall school year, we want to make sure that we're preparing our children as much as we can while we have them there. And so Greenville County Schools has really been great about giving us the standards of what each of the grade levels have and some ideas around curriculum that we can do in a camp setting so that we can continue to support our children, not only recreationally, which most people know us with the Y is recreation, but also academically. So we feel like we have a responsibility there too. So they have been a wonderful partner, and anytime that we need anything and support, that they've been willing to help us within this state of emergency.
Wonderful. So speaking of partnerships, Derek, First Steps has been championing some innovative strategies to support this need. Can you tell us about some of those ideas?
Sure. So, it's important for Greenville First Steps as a funder to make sure that we have an adequate supply of childcare slots for families. And so one of the things we were able to do is to continue to support organizations like the Judson Y, which provides incredibly high quality childcare and has a strong relationship with Hollis. And so having those public-private partnerships that can hand kids off to school district 4K and 5K programs is really important. And we're really thankful for the Y and St. Anthony's and other organizations that do that. What we've realized, though, in addition to that need, is there is still a huge demand for childcare that is not being met in childcare centers. And so one of the things we hope to launch this fall is a real intentional effort to recruit family childcare providers, which would be people who could care for children in their home. We want to train them how to do that safely and also how to be really strong partners with their schools, just like the Y and St. Anthony's are. And then our hope is to recruit them and train them and then to support them in that effort. Our goal is to have 40 new providers, which would be serving about 200 new children by the end of next summer, which would be a huge dent in the demand issues that we're experiencing. The other thing about family home providers that I think is important is as families are starting to decide whether to send their kids back to formal childcare or back to school, sometimes it's the number of children or people in one place that make families nervous. And so having a strong network of people caring for children in their homes should help ease some of the anxiety families may have with putting their children in childcare and help them get back to work. The other thing that we were able to do this year is we partnered with Homegrown, which is a national funder around in-home childcare, and we were able to send $1,000 grants to every registered in-home childcare provider in Greenville County just to help cover some of their costs. You know, I think one of the challenges, which is what makes county council's investment and ours so important, is childcare generally is there's not a huge profit margin in childcare. So if you lose 5% of your kids, you're not going to make budget that month. And childcare providers that remained open were losing 25 to 50% of their kids because families were furloughed, didn't have need for childcare, weren't paying for it. And so childcare providers are having to decide whether to keep staying open and run at a loss or close. And so I think what we need to continue to do, both through help with the chamber and through other organizations working with childcare, is to make sure that childcare providers have the financial resources and the supports needed to open back up so that they can continue to provide those services. And right now they're not getting that income financially from their parents because their parents aren't paying weekly fees. And so that's, you know, again, why that $1.7 million from county council is really so important, because a $10,000 grant to a childcare provider will make the difference in whether they're in business in September or not.
That was a huge benefit. So we look forward to seeing how that affects our local businesses. Derek, I know you wear many hats, and one is as a trustee on the Greenville County School Board. Can you look into your crystal ball and tell us what's going to happen this fall?
I cannot look into my crystal ball and tell you what's going to happen this fall. I can tell you that Accelerate SC is reviewing the report from the Accelerate Ed group, and we had a deputy superintendent on that group and a school board member from Greenville County on that group, and their 200 pages of recommendations came out yesterday. And I have read them all, although about 40 pages were about filters and HVAC units, which I did skim that section. I think there's a lot of unanswered questions about what services for children in public education can look like in the fall. There's questions about social distancing and how keeping children 6 feet apart from each other is feasible. As a parent of a 9-year-old, I think it's not always feasible. And so we've also got to look at places where we can create environments for kids to be back at school, which I think is the number one goal, is to get these kids back to school as quickly and as safely as possible, and to return to as much of a normal learning environment as possible. The challenges I see in the report that, you know, again, the Greenville board has not taken a position on, but we will be looking at tonight at the board meeting, is social distancing on school buses would mean that we could only transport 30 to 50% of kids who typically ride a bus to school. So what do we do with the other 50% of the kids? If you can't get on the bus, do you not come to school that day? Do we have to do alternate days so that we can get half the kids to school on Monday so the other half come on Tuesday? Do we require kids to have cars if they can get to school by car and only use buses for kids who literally cannot get to school any other way? Are we going to have to run multiple routes, which means kids would arrive to school an hour, 2 hours later than their peers, or leave an hour or 2 hours earlier than their peers? There's a lot of questions just around transportation that need to be answered. The other real question that I think the district's going to have to wrestle with is how many families don't want their kids to return to school. And if that's a large percentage, you know, that's going to require additional staff that we currently aren't equipped to handle. So the scenario that the superintendent talked about last night in the budget meeting, if a parent calls us and says, I'm not coming to school on August 15th, do we take them off the roster? Because what if they decide to come to school after Labor Day? And if we leave them in the class, are they receiving instruction for the month of August? And if they are, who's giving it to them? We know that distance learning and e-learning was forced on the district to handle an emergency situation, but it is not a long-term solution to educating our kids. I think our staff and our parents and our students did as well as could be expected. I think our non-compliance rate is like 1% of kids in the district who had a Chromebook and didn't use it as part of e-learning. So 1% is incredible, but we can't deliver an education system with kids solely using Chromebooks. So that's a long answer to say we don't know the answer yet, but there's a lot of things that need to be worked out. The one thing I would say to anybody who's on the webinar is there is a survey that the district is putting out, and they're closing it this week, and it's really important that families complete that survey. There are questions in the survey that have given families the impression that the district is already moving from 5 days a week normal school. And it's my impression that that's because 5 days a week normal school is what everyone wants, and it's what the district would like to have. The survey is saying, if we don't have that, what would you want? And so there are questions in there about different scenarios that really are presenting different options to families so that we can try to figure out what is the best next option for families to consider.
Derek, you gave us a lot of great information. One other question, just as a follow-up. Can you guess on the timing of an announcement?
No, I don't. I think, so one thing I have heard from the Accelerate SC people and from our superintendent is I don't think there's going to be an announcement. I think there's going to be a plan that gets implemented in August that might change to a different plan in October, and it might change to a different plan in January. So I don't think anyone should be waiting for an answer that's going to be the answer for the entire year. As our cases rise and fall, the one thing that the Accelerate Ed group made very clear is we should have different restrictions replaced and removed based on how our COVID cases are in our county, not based on statewide data and not based on a month ago's data. And so I think families are going to need to be flexible and to understand that it's going to change frequently. The administration said yesterday that their plan is to survey families again in July to see if any of their positions have changed from this week's survey to a month from now. And then I would expect by the beginning of August, we should have a good picture of what the first few weeks of school is going to take. But I don't believe that should be in any way interpreted as the plan for the entire year.
Okay, thank you. Speaking of surveys, the Chamber recently conducted a survey asking participants to weigh in on the fall schedule, and we also asked them to share what their organization is doing to accommodate childcare needs. We found that 2.6% of businesses offer on-site childcare, and 7.7% offer some sort of financial assistance for childcare. With so many centers closed, this leaves large gaps. One of the things that the YMCA does an excellent job of is identifying those gaps and filling them. What are you seeing as we move past the summer and into the school year, Julie and Stephanie?
So the Y is really what we're known for is responding to community needs. And we use the word pivot a lot when it comes to COVID. And so what we're doing here within YMCA Greenville is I'm creating a strategy team of experts within our YMCA leadership and potentially community leaders to see how we will respond to the schedule of Greenville County schools. So we need to be flexible. So if there is going to be a 5B option, we're looking at, do we look at year-round care? Do we look at full day care? Do we look at, virtual learning within our YMCA like we did within emergency child care? And so we are ready to pivot and be flexible in phases that Greenville County schools adjust to the best that we can. Like Derek said, transportation is one of those things that we're kind of an unknown for and what we're able to do. And so we're just trying to put the pieces together the best that we can, but we're up to the challenge to try to figure it out so we can be a support to our families when childcare is really an unknown for a lot of our families here in the community.
Stephanie, did you have anything to add to that?
I'll just echo what Julie said. You know, we listen to the community, we listen to what our families need, and we try to do the best to meet those needs, whatever that looks like. And we're, like Julie said, flexible and pivoting a lot, especially lately.
So we've discussed the access to childcare was a workforce barrier even before coronavirus. So say someone is listening on the call and they're motivated to help, to get engaged. From your perspective, is there anything that we as a community can do to help this issue?
I'll share a couple of thoughts, some things I've learned along the way the last couple months. Is that we need to work together. We need to understand that even though we might be representing a specific organization like the Y or the county or the city or a specific child care center, we all have the same goal to be able to serve our families and provide the best high quality child care experience that we can. And so I think being willing to step out and have conversations with like organizations to say, how can we solve this issue as a community and not as a single entity or an organization, I think would be very, very helpful, because I think the more we navigate it, we don't know what this new normal is like. And we talked in this webinar that there's phases and we're pivoting, and, you know, there's not anybody who's an expert in this. You know, we're all navigating this together for the new normal. So I think the more that we can pick up the phone or have Zoom calls with each other to try to figure out, what are you doing? What has worked well for you? What are your gaps? And how can we as organizations support each other to fulfill the need for our community, I think would be a best practice that we can all commit to do.
Glad Julie went first, because that was a really good answer. And I as she talked, you know, she mentioned the partnership that was implemented this spring, and really it is a great example of how the YMCA, the school district, First Steps, Prisma kind of all got together and said, how do we fill a need that exists? And I think there needs to be more conversations like that. And I'm just so proud of what the Y was able to do for emergency responders and healthcare workers during that time. You know, the one thing, Cheryl, I would say that I would say there are two things people on the call could do. One is most of our quality childcare programs in the county that are closed are currently in churches. And so the church isn't worshiping, and so all of the services provided by the church aren't worshiping in person, which means childcare is probably not operating. And I think anything anybody on this call can do with the church that they are a member of to make sure that they understand that childcare isn't the same thing as a youth group. And if we can get those childcare centers opened back up, even while the sanctuary may be closed on Sunday, it would be a huge ministry to our community. And it's something that, you know, really on a church by church basis, it's just going to have to happen locally. Most providers who are closed are either government funded or church-based providers. So that would be huge. The other thing I would recommend is if anybody on the call knows of folks who might want to care for children in their home, then we are going to start a cohort of providers this summer to train people how to do that. And even if you just wanted to do it on a 6-month basis, the next 6 months are probably going to be the most critical time for us to have providers. And you can go to Greenville First Steps website, or you can go to greenvilleparents.com, and you can see on those two websites how you can sign up to be a provider within this system. So those would be my two recommendations.
Okay. What about businesses? What about childcare centers in the area, church centers in the area, who are scared, who have questions, who don't know what to do? How can, you know, who should they reach out to, and what can the Y do, and what can First Steps do to help them prepare for a reopening, or you know, fully integrating children back into their center?
So First Steps is happy to help any provider that's thinking about reopening, help them talk through it and help them get connected with providers, both for-profit and nonprofit, who have done this and are currently doing this. And I think about just up the street from us is Primrose, and they remained open and are always willing to go out and provide training for folks on how to do it. I know we've talked a lot about the great things the Y is doing, but the YMCA of Greenville is a case study in intentionality around protecting children and staff's well-being while also providing quality care. And as a parent of a 9-year-old who wasn't really sure we were going to get back to Camp Greenville this summer, I mean, what Camp Greenville published for families was a model that other providers should be looking at. Their blog is on their website, and just the amount of thoughtfulness that went into every decision that's being made at camp was really incredible. So I'd tell them to go look at the other documents that Julie's helped create and go look at Camp Greenville's blog as two really good examples of how to be thoughtful about safely reopening, but also providing a service that is really important.
Okay, thank you, Derek. We do have a couple of questions. One question is from Jason Zacher, who does advocacy here for us at the Chamber, and he's directed this to Derek. The state appears to have done little to nothing to loosen up childcare. What can or should business leaders do to lobby the State House, the DSS, government? What can be done?
Yeah, so thanks, Jason, for participating in the call. There are two things right now that need to happen, and they need to happen quickly. One of them is the staff in licensing are not working from their offices. And so if an organization needs to be licensed or needs to be relicensed, they're not able to get those appointments made. And so advocating for the state to direct DSS to get those staff back out doing licensing visits is essential to getting these organizations back open. And really, they are providing a lot of supports remotely. So I'm not saying that the DSS is not, but getting out there is essential. The other thing is there are a certain number of hours that every provider is required to have of professional development. And most of those hours typically are delivered in face-to-face trainings. But SC Endeavor, which is the entity that approves trainings, has prohibited all face-to-face trainings going forward. So these providers have now got to all pivot to online training, but there's not a lot of flexibility in how those online trainings are delivered. So for me, the two most important things would be get DSS licensing people back into centers and get the licensing applications fast-tracked, and then provide more flexibility around online training so that during the state of emergency, people can get their hours without having to do face-to-face training, but also without having to comply with some pretty restrictive current online training guidelines.
Thank you, Derek. That's very helpful. If there are any other questions, please submit them through the chat feature. We can't thank you three enough for the work that you do and how you brought the community together to serve children and the parents of the upstate. Do we have any other questions? Got a couple of comments. Thank yous to the Y for stepping up, much appreciated. Again, I'd like to thank our sponsor, Spectrum Reach. Don't forget you can learn more at the link in the chat feature. Derek, Stephanie, and Julie, thank you for participating, and attendees, thank you for joining us. The recording will be shared on the Greenville Chamber's website and sent to attendees along with a survey. Don't forget that this is part of an ongoing series. Next Thursday, Tracy Newkirk will join us to talk about leading through anxiety. We hope that you'll join us. Thank you all very much.